Welcome to the Road to Recovery Joint Preparedness class. The goal of this class is to set clear expectations for how you can best prepare yourself before, during, and after surgery for the best possible outcomes. We will provide you an overview of your day of surgery, helping to eliminate any fears and uncertainties. We will deliver quality information and resources for your most successful road to recovery. Today's class agenda will start with preparing for surgery, walk you through your day of surgery, care needed for after surgery, discharge information, and your road to recovery booklet. There are a few tasks you'll need to complete prior to coming in for surgery. First, you'll need to select your caregiver for after. Your caregiver must be a responsible adult, age 18 years or older, and remain with you for a minimum of 24 hours after surgery. You will receive a pre-op phone call. This will come from our pre-anesthesia testing nurses and will come to you about 2 weeks prior to your surgery date. You will need to see your primary care physician within 30 days of your surgery date and complete any testing that they order prior to. We will walk through enrolling in StreamMD after this class, and then we need to prepare your home. Readying your home starts with removing any tripping hazards, rolling up any rugs or anything that you could easily trip on. Ensure clear walking paths, cleaning up any dog toys, cat toys, or anything that could get into your way. Pre-planned meals, things that are easy for you to reheat or make or put together by yourself. Assistance with daily chores. You will need help with grocery shopping, light cleaning, and laundry. Loose fit clothing will be the most comfortable thing for you to wear after surgery, things that can get on and off easily. You will need medical equipment in the form of knee immobilizers for the knee replacement patients and walkers for both knee and hip replacement patients. Access to bathroom and bedrooms. Can you walk into your bathroom and bedroom using a walker? Can you turn around easily in that space with using a walker? And can you get yourself on and off of the toilet in the bathroom with using a walker and having one leg not work the best for you? Nutrition status is important because surgery causes stress on the body, which can temporarily weaken the immune system. This can result in complications and delayed healing. We encourage you to increase protein, fruit, and vegetable intake prior to surgery. Drinking at least 6 to 8 cups of water daily the week before surgery can help lessen pain and nausea following surgery. It is important to note weight loss efforts should stop 1 to 2 weeks prior to surgery to promote healing and recovery. Pre-procedure exercises are found in your Road to Recovery booklet. They are a little bit different between hip and knee patients, and your book should coordinate with the surgery that you are having. We ask you familiarize yourself with these exercises to help build up strength and promote faster recovery. These exercises should be done twice daily for 2 weeks prior to surgery. Outpatient physical therapy will need to be scheduled for you. Our knee replacement patients, this can either be done at an outpatient physical therapy location or home health coming in to work with you. Appointments should start between 2 and 7 days following surgery depending on who your surgeon is. And pick a convenient location and schedule time for someone to drive you to and from these appointments. Hip replacement patients' physical therapy is determined by a case-by-case basis. Advanced directives are nice information to have on file for you. It is not mandatory that you have this filled out prior to you coming in for surgery, but if you do have one, you can bring it with you and we can get it scanned into your medical record so it will be there throughout the whole Pro Healthcare system. We do ask you notify us of any changes prior to your procedure. If you have any of the following changes, medical or dental surgeries, skin integrity concerns such as wounds, rashes, nicks, a nursing staff will safely shave your surgical extremity for you day of surgery, infections such as sinus, cold, or flu, recent or new antibiotic use, or if you accidentally ate or drank anything after midnight coming in on your day of surgery. Preventing infection. The night before surgery, you will shower with your own shampoo and soap. Then you will use the first bottle of the CHG soap which you have been provided. The soap will go everywhere except for your face and your privates. You will step out of the stream of water to let the soap sit on your skin for 2 minutes. After that timer has gone off, you will rinse all of the soap off and dry with a fresh towel. We ask that you sleep in clean sheets and pajamas, and you do not let your pets sleep in bed with you. The morning of surgery, you are now going to shower with the second bottle of CHG soap that you have been provided. Again, stepping out of the stream of water, letting it sit on your skin for 2 minutes, rinsing and drying off with another fresh, clean towel. You will dress in clean, loose-fit clothing, and we ask that you do not apply any lotions, deodorants, or perfumes, and leave all jewelry at home. This does include wedding bands. And finally, do not shave your surgical extremity. We will do it for you day of surgery. When you arrive to the surgery center, you'll walk in through the main entrance, take a left, and enter through our surgery doors. You'll check in with reception. We do ask that you be on time for your surgery. Female patients who have not yet gone through menopause will need to wait to use the restroom until a pre-op nurse comes and gets you. Remember to bring all medical equipment with you for day of surgery, and be prepared to remove glasses, contacts, and anything removable from your mouth, dentures, partials, retainers, and hearing aids. On the day of surgery, you're going to meet many members of your surgical team. This will include your orthopedic surgeon, anesthesiologist, certified nursing assistants, physician's assistant or nurse practitioners that work with your orthopedic surgeon, nurses, and physical therapists. In the pre-op department, you will meet your pre-operative nurse and your operating room nurse, your surgeon, and your anesthesiologist. We do recommend that your support person is present with you in the pre-op department to help listen in to all the information that is given to you and help you remember any questions that you had wanted to ask. These are our 3 main anesthesiologists for our surgery center. You will undergo general anesthesia along with a nerve block, which is appropriate for you for your post-op pain. Your anesthesiologist will talk to you about your medical history and surgical history, so let them know if there is anything that you did or did not like about any previous surgeries you've had. For the nerve block, your anesthesiologist and surgeon will best decide which nerve block is best for you. When the nerve block has been decided for our knee replacement patients, it will occur in the pre-op department. You'll be given an IV sedative, which will make you feel like you've had a few cocktails. It will be done under ultrasound by the anesthesiologist. For our knee replacement patients, there will be 2 different types of nerve blocks. The first is called Expro. It is a single injection done into your upper leg, and it will metabolize in your body over 3 days. Nothing will need to be removed, but you will need to wear your knee immobilizer each and every time you're up and walking around until that block has worn off. The second option is an on-cue pain system. It is a ball that is attached into your upper thigh. You do have a patient-controlled dial where you can turn the medication up or down depending on your pain needs. The ball will last about 3 to 5 days depending on the rate that you are setting it at. It will need to be removed at home, and you are unable to shower until that on-cue ball has been removed from your body. This also will require you to use a knee immobilizer each and every time you are up and walking around. For our knee replacement patients, that knee immobilizer will be on again each and every time you're up and walking around. It helps provide stability and prevent the knee from buckling while you are walking. When you are at rest, laying down, resting, relaxing, the knee immobilizer should be removed and range of motion and icing will be performed. After surgery, you will enter into our post-op department where we will be closely monitoring your vital signs such as blood pressure, heart rate, and oxygen, pain levels, nausea, how alert you are, and any special considerations. This is when you will receive your glasses, dentures, partials, and hearing aids back if you would like them. While you first enter the recovery room, your surgeon will be meeting with your support person in a small consult room to let them know how surgery went. If your support person is unable to be here at that time, the surgeon will call your support person to let them know how surgery went. Your post-op nurse will schedule physical therapy when you are ready for it. The physical therapist will properly fit your walker and review the exercises outlined in your Road to Recovery booklet with you and your support person. Prior to discharge, you will walk in our hallway, climb up 2 stairs, walk down 2 stairs, and you will need to urinate prior to being able to be discharged home. The post-op nurse will determine when it is safe and you are medically cleared along with your anesthesiologist prior to discharge. This will take approximately 1 to 3 hours after you have come out of the operating room. When it is time for us to go over discharge paperwork, we will discuss the paperwork with your support person. Information that will be given to them, which is written down and highlighted, will show medications that you are being prescribed and when your next doses are due, what blood clot prevention medication your surgeon is putting you on, any appointments, physical therapy through the Pro Healthcare system, and your post-op appointment will read on your after visit summary, dressing care, when to remove the dressing and when to shower. Typically, your surgical dressing will stay on for about 7 to 14 days after surgery. This dressing will need to be left completely alone. We are not going to peel it up on the corners or look underneath it during that time that is to be left alone. Also, we will go over your medical equipment use, how to use it, when to use it, and when it can be discarded. Pain management following surgery. Pain after surgery is normal and expected. We use the 0 to 10 pain scale, and it is important for all patients to determine what a tolerable pain level is for them and when to medically treat pain appropriately. Some pain is expected, but it is important that pain does not reach an intolerable level so that patients can heal optimally and perform the expected post-op exercises. Pain management is done with different interventions. The first set of interventions are pharmacological. Those will include the nerve blocks or spinals that you receive as a hip replacement patient, narcotics, Tylenol if you're able to take additional Tylenol with your narcotic pain medication. This will be listed on your discharge paperwork. Anti-inflammatories will be resumed along with your antiplatelet or blood clot prevention medication. Non-pharmacological interventions include ice and cold therapy, elevation, and positioning. It is important to note that some narcotics do contain Tylenol, and you are not to exceed the maximum daily limit of 3,000 milligrams within a 24-hour period. Side effects of narcotics include nausea. We want to ensure that you're eating something of substance 20 to 30 minutes prior to taking your narcotic pain medication. Drowsiness. It is unsafe to consume alcohol or drive a car while using narcotics. Constipation. It is encouraged to incorporate adequate water, walking, and the use of a stool softener or laxative while consuming narcotics. After surgery at home, you will have some post-op observations. First and foremost, swelling and bruising. Swelling and bruising will peak 1 week after surgery. It will hang around for another week after surgery, and then it will finally start going away. Pain and fatigue are also normal, and every observation can vary from patient to patient. Resting, icing, and elevating are important for everyone in their recovery. Once you return home after surgery, it is now your turn to do the best for you for your recovery. This includes early movement and walking. Knee patients, when you're up and walking around, you will be using a knee immobilizer until your block has worn off or you have removed it from your body. Pain management and performing post-op exercises as outlined in your Road to Recovery booklet. We do have some things that we would like you to notify your doctor about if any of the following of these things occur. Sudden loss of warmth, color, feeling, or movement in the toes of your operative foot after your nerve blocks have worn off. Heavy, fast bleeding that soaks through your bandage because we want to keep that dressing clean, dry, and intact for 7 to 14 days after surgery. Inability or uncomfortable feeling with not being able to urinate. Any warmth, tenderness, pain, discoloration, or swelling to the lower leg where we're thinking that there's a blood clot forming. Severe pain not relieved by pain medication, elevation, and ice. Temperatures over 101 degrees. Redness, extreme tenderness, or warmth to the surgical incision. We gave you a lot of different instances for when you need to contact us, and now we will break down who you need to contact for what issue. First, any condition prior to surgery would be going to your orthopedic surgeon's administrative assistant. Their direct numbers are listed on the following slide. Questions after surgery, our nurse triage is available Monday through Friday from 8 to 5. The phone number is listed below. After hours and on weekends, it is the same number as nurse triage, as you can see on this slide, and you will follow the prompts to reach an on-call physician. We ask that you do not leave a voicemail after hours or on weekends. This is the list of the administrative assistants and which surgeons they work for. And then the Stream MD, each surgeon has their own specific phone number, and you would text that number with the word join in order to set up this system. This system is nice. It gives you text messages with videos, tips, and tricks throughout your recovery process until you are discharged from your orthopedic surgeon's care. All right, thank you for attending the Road to Recovery Total Joint Preparedness class. I hope that this has answered a lot of your questions and made it easy for you to have your road to recovery start.